So let me introduce myself. I'm Dr. Mukarram Siddiqui. I've been associated with DMC since 1992. So I've been part of this campus as well as campus downtown. And I've been intricately involved in taking care of you and your families for the last several decades. My journey in medicine started in 1983 as a teenager. That's when I got into med school. And all I wanted to do when I got into med school was I wanted to do cardiology. So cardiology fascinates me. I live and I die for cardiology. It's something that I really find it very loving, very relaxing, taking care of patients. What I find taking care of patients with heart diseases, they have this fear that they are going to lose control of their body. They have fear of dying early. And I have seen how cardiology has contributed, the research in cardiology has contributed in improving patient care, okay? So back when I started, when you had a heart attack or any kind of heart rhythm issues, it was pretty much a death sentence, prolonged bed rest. You come in with a heart attack, you get your angioplasty done, you're going home the following day. You don't see those rare complications that we used to see back in the day. So thank God for that. Thank God for the research that has happened. And United States of America has contributed hugely for improving the healthcare. So having said that, I do strongly believe that knowledge improves how you live your life. And when you live your life good, in a healthy fashion, it contributes to you living longer and you having quality of life. So to fulfill that mission, I'm here today, and I want to thank DMC, first of all, to give me an opportunity to get trained over here. I would like to thank the community for entrusting me with the care, because there is a trust between doctor and patient. And I really want to thank the research that has happened so that I can offer cutting edge treatment for people that come to DMC. So having said that, there are a few things that I want to concentrate on.
What causes irregular heartbeats?
There are a number of different things that can cause irregular heart beats. There are a number of conditions such as atrial fibrillation. As we age, we are more predisposed to developing abnormal heart rhythm called as atrial fibrillation. High blood pressure, diabetes, sleep apnea, being overweight contributes to that. Ventricular tachycardia usually is seen in people that have heart failure with reduced ejection fraction, a prior history of heart attacks. It can happen. You can get extra beats just because you drink more coffee or tea or smoke regularly or excessively. It can cause that. Electrolyte imbalances such as low potassium or magnesium can do that.
Would you suggest that we take supplements then?
No, you should be very careful taking potassium because you need to know your kidney function to start with, and if you have compromised kidney function test, taking potassium can be dangerous. So do that under supervision. Health supplements are generally discouraged because the diet over here is pretty good. So in the sense, you're not deficient in vitamins, okay? And then potassium and magnesium are well taken care of, okay? So you're not going to get nutritional abnormalities, okay? Yes, sir.
Okay.
Electrophysiologist.
Right, yeah. Okay. Now, the things that you do electrical, is that frequency of energy that you're helping the heart to,
Yes.
so we're energy beings, so you're doing something energetically, frequency, vibrational, to stimulate or activate the heart in some type of way so that it regulates. Can you break that down for me?
No, if you have a slow heart rate, you get a pacemaker in which you get your heart rate back to where it needs to be.
So what does the pacemaker do actually?
Pacemaker stimulates the heart by electrical delivery of electrical current.
As vibration?
That's not vibration. Vibration is this is what we use in the electrical bulb.
Okay, yeah.
Okay, does it stimulate your heart consistently or only?
As needed.
Only as needed.
As needed.
DMC is one of the greatest hospitals, like he said, in this country, in this city, in this state. We have preventative care guidelines that everybody should follow. Some of the other countries the access to healthcare is extremely poor. It's not that they don't have healthcare, it's extremely poor and it's selective. If you have money to gain that access, you can get there a little bit quicker. Same thing with Canada. Canada has nationalized healthcare, but in nationalized healthcare, you just can't run to an urgent care center. One of the kickbacks we get at Sinai Grace, our ED is overwhelmed. Why? Because people run to the emergency room for everything. If you would get a relationship with a doctor, a primary care doctor, and have regular routine checkups, do your preventative care, colonoscopies, your mammograms, your PAPs, your low-dose CAT scan, just don't come when you have a headache when it's a problem, because if it's a problem, it's already a problem, right? One of the things that Dr. Siddiqui was talking about, and we kind of touched on beforehand, heart disease is the #1 killer. This says in African Americans, heart disease is the #1 killer, period, not cancer. Heart disease is the #1 killer because of us and what we don't do. I have some healthy heart tips up here for you and 9 signs of heart attack. But more importantly, on everyone's table, I have this flyer. Please take the time to scan this QR code. Please scan your QR code. Not only will you stand the opportunity to win a smartwatch, you're going to be getting texts and emails on Healthy Heart Initiative. We kind of dropped the ball because we should have had on red because it is Heart Month, but I do have the hearts up here on the table. But this month we are pushing Healthy Heart Initiative. So it's no accident that the doctor last week was talking about strokes. The doctor here is talking about our heart health. We are responsible for our heart health. Please take the time before you leave, scan the QR code. It's free. It's not going to cost you anything. You're going to get more information. If you have questions on that, please see me. If you need to hear about preventative care, what your insurance company covers, and this is even for government marketplace insurance, you get preventative care services. We would much prefer to cover preventative care than covering a catastrophic care. So if you come to the emergency room and it's overwhelmed, that's typically because of something chronic or because people have put off the care that they need to receive. So that's what we're here talking about. Each one has to educate one. We thank Detroit Coffee Lodge, San Bernardo Park Association, the Detroit Medical Center for allowing us to be into the community to talk to you guys one-on-one.